who is with me today, and we will be addressing some of the issues that I do not address. And because I'm keeping proper social distance, I can be able to speak without this thing. I want to start off by just talking about where we are currently, what we have done so far. As you know, we are in the third month of our battle against this disease. As a government, we have prioritized our preparedness. We have got commitments, and we are operating from a multi-sector approach on this, making significant steps. But let us not forget that even as we talk about our success, the virus is still in our midst. In the last 24 hours, for example, if you look at the graph and the regions, you can see that globally we have 4,618,000 cases. We have got 311 persons who have died, and the case fatality across the world is 6.8%, while within Africa we are lower at 2.9%. But you must remember that that's an average. That is not everybody. Again, if you look at what we have tested in Kenya, we have tested this figure there, 46,784 samples. The positive cases so far are at heading towards the 1,000 figure. And the active cases we have, because we have recovered 358, and therefore the active cases, the cases of persons who are still within our care, is 555. Now you must remember again that we are glad that out of those 555 cases, we actually do not have anybody who is symptomatic as such. We have nobody on ventilator, and we have nobody on oxygen. Now this is a comparison of is a comparative analysis of what is happening elsewhere in ourselves in understandable terms. If you look at this curve here, this green one, that's us, that's Somalia, and you can see that at some point they were way below us on this point here. Now you can see they have gone on to pass the incidences from Kenya. Uganda, again, Uganda you can see was climbing up very, very fast, but if you remember they made very serious containment measures, and you can see that their curve has flattened. They went for a complete lockdown, etc., and you can see where they are now, right here below Kenya. Again, the United States, as you can see, having the largest number now on Earth at almost 5 million incidences. This is an interesting comparison that I would like to bring to your attention. We want to compare here oranges with oranges. As at the 30th day, from the time that each country got its first case, please note, from the day each country got its first case, the number of cases from the 30th, from the first day, the United States had just gotten 15 cases from the time it started. South Africa had 1,585. Kenya, if you remember, we had 191. Somalia had 80, and 58 in Uganda. Now, number of cases on the 60th day, in other words, in a period of only 30 days, the number of cases in the US, you can see the increase. The percentage increase there, almost 94%. You can see the increases in South Africa from 1,500 to 7,000. The increases in Kenya from 191 to 715, which is about 2.7 times folds. Somali, you can see the increase, and you can see Uganda much less, again, because of the total lockdowns that they had. So just to come now closer home again, to really spell out what's happening on the ground. If you look at the map here, the last time that I brought to your attention this map here, the number of dots were much lower than today, because as of today we have 23 counties that have got positive cases, all the way from up here in Mandera, all the way down here in Mombasa. You can see Nairobi here, we have sectionalized Nairobi at this spot, and you can see Kamukonji, just about here in the center. Again, you go to Mombasa, and you can see what is happening here essentially around the old town, with our fatalities still remaining at 50, thank God. This is a distribution of cases by county. I would like you to look at the Nairobi cases, and this is an important figure to note, that we have now got 470 cases in Nairobi, while we have got 331 here in Mombasa. But that, you can see the figure in Kajiado, and please note that Kajiado figure again, because there's a specific reason why Kajiado has continued to grow like that. And then Mandera, Kiambu, its proximity to the town, Wajir, I'll explain again why Wajir is now here. Majia, Mandera, I'll explain all that as we move on. Again, this is to show the summary, but to look at the incidences, what happened after testing of persons in quarantine. And this figure here, the blue line, is the one that tells you the actual figures per day. And you can see it's fairly even, except for certain spikes, but cumulatively, as you can see, the figures in the country are continuing to go up. And that's the important thing, because it might not be increasing at a very fast rate, but nonetheless, it is going right up. Then if you look at the age groups and how they have been infected, 0 to 9, very few, 60, the main group, the main infections are here, between 20 years and 39 years. This is where it is the largest. And this is what we are calling mosquitoes, because a lot of them carry, but they don't actually succumb to it. With about 963 cases, the number of female infections, 38%, male, 62%. You can see that this gap has widened. As cases have increased, the gap has widened, and perhaps the doctors will tell us why this is the case, why we have got almost, nearly heading almost to double the figures. Now, I want you to look at this map very carefully to note that the importation of cases from the neighboring countries, look at that. That is Wajir. Wajir now has got 14 cases around here, and out of those 14, 12 actually are from neighboring Somalia. Around about here, as you know now today, we have got some more cases. And then largely you come to this border, particularly in the southern border. This is Isibania. You can see we have got 10 cases, and these are the cases we are talking about that have come from the neighboring countries. Namanga, the same thing. You go to Lunga, again, we have infections here. But the most important thing is not even these levels. We had our team, led by Dr. Amoth, that went to look at the situation in Namanga the other day. We have a team that went to all these border points from the Ministry of Health just to see the measures that can be taken. And what we are doing here is that we have increased the Nyumba Kumi activities in all these bordering counties. so that because there is a porous border, and a lot of people can come in even without using the border points. So what is happening now is that the Nyumba Kumi people are being asked to watch and see if there is anybody who has crossed the border. Then they must report to us, and they must report to the authorities, because one of the cases who passed away at Kenyatta National Hospital actually crossed through this porous border and eventually arrived here in Nairobi. All these places, we have moved PPEs in all these places so that we do not have situations where our people are exposed. We are deploying. We have got 2 mobile laboratories coming from the EAC, and we have deployed 1 mobile lab in Namanga so that we can be able to be testing from there, and we are going to deploy another one in Naivasha, the new center now where the trucks are coming, so that in the event that somebody has not been tested, we can test from there, remembering that that's not the protocol. They are supposed to be tested before they get there. But the reason why we have to deploy this lab in Namanga is essentially not so much to test the Kenyan drivers, because they will have been tested elsewhere, but it's more to assist our brothers from Tanzania. Now, this is now critical and might explain to you why the president took the measures that he did the other day. If you look at Isebania, we have got our own cases, as in 10 cases, but we have returned 4 persons towards the Tanzanian border. On the Lunga Lunga side, you notice that we had only 3 cases, but we have returned 24 truck drivers on the Tanzanian side. If you look at Namanga again, I read that we have got 16 cases in Namanga, in Kajiado essentially. Loitoktok, we have 1 case, but we have returned 5 to the Tanzanian side. The same case, look at this. This here is 16 cases in Kenya, but we have returned 126 drivers who tested positive. When we tested them across the border, they tested positive and therefore could not enter the country. So in other words, out of the 214 cases that have been detected on the Kenyan-Tanzanian border, 182 were foreigners. 182 of them were foreigners, and therefore what would have happened had we not taken the measure of testing at the border is that these 182 people would now be in our midst. They would be moving around the country, and you can therefore imagine the rate of infections that this would have caused. Again, look at Wajir, 14 cases, all right, 16 cases crossed the border through the Kenya-Somali border. And today, we have 2 new cases confirmed in Garissa County. So Garissa now joins the counties that have got infections. Again, is recently crossing from Somalia. This is why we are talking about the Nyumba Kumi being a very important and critical unit in fighting this disease. Because what it means is that the entire border, from the north to the south, on the Kenya-Somali border, we don't have policemen at every point. So our policemen are supposed to be the Nyumba Kumis who must report. And they have continued to do so. And I want to thank them. I want to thank them sincerely, because they are the ones who have detected all these cases that we have got here. Now, again, to emphasize the critical importance of just a single individual, just to show you what a single individual can do. And saying so, remember that the first case in Meru County that we have reported actually came out of a hotel owner, James, who decided that he has to test all his hotel keepers before they resume work, and one of them was positive. Fortunately for him, he discovered it on time. He has got his hotel workers now in quarantine. But you can imagine, if you consider this graph, then you can see that this diagram, then you can see what I mean. The first case here in Kilifi, you remember case number 14 in Kilifi, transmitted to case number 48 in Rabai, transmitted through that case to case number 141, who transmitted these two now, case number 41 and case number 187 coming from this direction, and now where were they? They were now in Mombasa. Now look at what happens then. So this case comes down to case number 15, case number 30, all that. And then on the third line, case number 44, is it 44? Case number 44 now drops down to all these cases. And you remember in Korea, there was a famous case number 33 or something, who infected almost 5,000 people. Now you can see what has happened all the way from here, coming down, and all these people, all these cases have now come out of these people. There is another point to notice here and to record. If you look at this line here of the infections that came from this character right here, you'll see that case number 140 got 2 infections. This case here got all these people. This one, even more. But look at this. No infections here yet, no infections here yet, no infections here yet. Perhaps telling us that these people were keeping social distancing and refraining from contacting others, and therefore, this is where we have been saved. These ones have been our savior. Because you can imagine if each of these people was like this, and now we don't know what is going to happen to each of these red cases. It just emphasizes the importance of one person. Further, when you look at the restrictions and why we put the restrictions and is to justify these cases, look at this yellow line. This individual, KPA staff, left Mombasa on the 5th of April. They came and spent a night here in Nairobi, okay? They left for Siaya the next morning, stayed overnight in Kisumu before proceeding to Siaya and being confirmed positive thereafter. And then starts the whole chain all over again. One person. Let's look at this case. The case in purple started here in Kilifi, moved all the way to Mombasa. There are 2 individuals here. Is a sister and a brother who left Mombasa at night, proceeded to Mandera the following day. They came through here. They proceeded on this path via Wajir all the way to Mandera. Now, 6 cases are linked to those 2 people who traveled through that route. 2 people only, and maybe one of them only, was positive, but 6 cases thereafter. Now, as regards why we have again contained some of the areas in Mombasa, Old Town, and here in Isili, again, look at this. You can see the spread, particularly in Mvita, in Mombasa. Mvita in Old Town is the highest cluster that we have got. You can see that in terms of the denseness of an area and the number of cases in that area is here in Mvita. And I want to thank the Mombasa governor for doing everything that he can against a lot of opposition and a lot of opposition for trials. But I want to say that Governor Joho has really, really tried and put in a lot of measures and capacity for the people of Mombasa County. In Nairobi, you can see again Kamukunji, essentially around about the Isli area, 104. You see that is almost double everything everywhere else. Dagoretti, again, this is Kawangware. Kawangware, the cases that are appearing in Kawangware, these are slowed down a little bit now. Embakasi, the same thing, and so on and so forth, all the way down to Makandara. And this one we had seen. Let's flip again. Continue. Again, this we looked at, but again here the issue of the deaths that we have experienced. 0 to 9, We had just one or very few. 10 to 19, no deaths. 20 to 29, no deaths. 30 to 39, a few. And you'll find that these people were people with other underlying issues, diabetes, heart disease, HIV, and so on and so on and so forth. 50 to 59, you can see that gap, and then here comes where some of us belong, and the danger thereof. If you look at now, this is important to note again. If you look at the distribution of deaths across the country, you will see the one in Bomet, the one in Kiambu. Look at Mombasa and remember the numbers. Nairobi had almost 100 more cases than Mombasa, but look at the number of deaths. Mombasa has more deaths than Nairobi. This is why we have been explaining that people must not be kept at home. You must leave your house. If you die at home, what it means is that the rate of infection and the rate of mortality is going to be a lot higher than had the person been infected by somebody who is almost asymptomatic. So I think we should make it clear that the rise in deaths here in Mombasa is essentially people dying at home. And we want to urge that nobody, if a person is unwell, please take them to hospital. Because if they are unwell and you are the one who is looking after them, chances are that you can yourself die and pass on. So this is our testing capacity. As you can see, we have made, there was a time we were here, we were at 0. Less than 3 months ago, we were at 0. This is what we have done. In all that time, I want to really thank our people in the labs, our laboratory technicians, our lab heads, Kemri, our infectious lab here, and all these people who have developed the capacity to test in that time, and therefore increased our protective capacity and our protective ability. So we have got all these 20 labs, 10 in counties, public and private, which are fully operational, and we will continue to expand our lab capacity. In the next couple of weeks, in the next 2 weeks or so, we will probably be adding another maybe 5 testing areas. We want to start spreading it towards the north, towards central Kenya, have testing capacity there, because it is only we would really know what is happening around the country. Now, I'm glad that my brother CS is here, East Africa, because if you look at this, if you look at all these, the initial situation at our border crossing, this is what it was looking like, all the way down, and some areas in our borders, it still continues to look like this. Now, on our side, on the Kenyan side, we have largely cleared the backlog that has been there, and it is because the protocol is that you are supposed to be tested before you leave. And if you do that, it means that you are not waiting at the border to be tested. You have already left having been tested. So if everybody were to follow that protocol, there would be no reason why all these trucks would be there. Now, let's also be clear that the reason why on the Tanzanian side there is a backlog, it is not because of us wanting to keep them there. We want to clear them as quickly as possible. But it's just that on the Tanzanian side, they have not been tested. So at a great cost to us, we have to test them because they are our brothers and sisters, and we also want to do business with them. We want to trade with them, but we cannot allow people from outside Kenya to come without a COVID-19 free certificate, just like we are not allowing Kenyan drivers to leave Kenya without a COVID-free certificate. So the idea is to try and fast track this as soon as possible. That's why we have got this mobile laboratory that we have taken down to the border. But I would like, when I finish, I'm sure my brother, CS Mohammed, will have something to add on that. In terms of what we want to do and going forward, first, let me just emphasize that we have got a totally coordinated and complete government approach. This is not a Ministry of Health issue. This is the whole government approach, led by, of course, the National Emergency Response Committee on Coronavirus. We have increased our targeted testing. Now, and this is, we should make this very clear. There is no country in the world that is just going around the streets and testing everybody. Everybody goes for targeted testing because you can be very wasteful also. And I explained, I think, in one of my pressers how expensive it is to test. So what we are doing is essentially focusing on areas that we believe, we have reason to test. And that's why you see our figures going up, because we are going to areas that we believe have got it. Otherwise, it is quite possible to test double the figures that we are testing and have a lot less figures in terms of infection rates, because of not going to places that you really ought to be looking at. Again, continuing to upscale our testing capacity, our labs. We will continue with travel restrictions, at least in the foreseeable future. And then we have got psychosocial support and reintegration. In the midterm, we are looking at further coordination by NAC. We are talking about capacitating tests. We are making that even wider. We are looking at rethinking our whole issue of quarantine and isolation, both at national and county levels. For instance, if we notice that the people who have tested positive are not sick themselves, we don't have to keep them in hospitals. It is possible for us to reinvent that, to change that, and now start keeping them in isolation facilities and moving somebody to a hospital only if they need hospitalization. So we are looking at that and looking at hotspots and ensuring that in every area where we think there is any chance at all, we are making sure that everybody has got PPEs and so on and so forth. Again, re-emphasizing on psychological and psychosocial support. But in the long term, again, an entire government-wide approach. In fact, NAC at that point becomes only one of the four units that we are using to coordinate entire government effort, for all the way from the command center and our security, all the way to agriculture for food security, all the way to industry, and so on for post-COVID-19 strategies. Again, the issue of restrictions, lifting restrictions, we are looking at that and wondering and looking at how exactly to do that, so that we do not open and then experience what a lot of countries have experienced, where they went for these strategies, opened too soon, and then immediately had an upsurge of deaths and infections. We will need a lot of psychological and psychosocial support, as I said, for integration of people, particularly when they come from quarantine facilities, when they come from isolation facilities, when they come from hospitals. And I think we have spoken at length about the issue of stigmatization and ensuring that people, who come back to society are not stigmatized, because, as I have repeatedly said, anybody, and I mean anybody, can get the virus. And we must have empathy and must support those of us who fall to the disease and to the virus. Therefore, I just want to conclude by once again, I want to thank each and everyone for your support and cooperation. I want to support the Fourth Estate for keeping the fire burning and keeping the people informed. and particularly emphasizing that the war is not won yet. But I am happy with a lot of Kenyans who have continued to support the cause. We are happy about those people who have taken the measures as seriously as they have. And it is because of that, it is because of the cooperation of Kenyans. Even when we notice a lot more people in town, you'll notice that even as they come into town, they are coming with masks. You know, 3 months ago, less than 3 months ago when we met, none of you guys had a mask. Today, everybody has a mask. That's called progress. Asanteni. Yes?
Very good. Thank you very much, Honorable Kagwe, my colleague. I think, first of all, before I comment on what is going on within EAC, I just want to make a brief comment on the observations that I've made on the numbers of infections and the deaths that you have reported. You know, when you see Old Town and when you see places like Kamukunji, you know, the rates of death and the rates of infection seems to be extremely high in those areas. And those of us who are Muslims, especially at a time like now during Ramadan, there's a lot of coming together. There's a lot of coming together for prayers, a lot of coming together during breaking fasts. And we can easily forget the need for us to do and practice social distancing. And I really want to appeal, numbers don't lie. One of the highest rates of death is being announced in the Old Town in Mombasa. I just want to appeal to our Muslim brothers and sisters during this period. The risk and the intensity of risk gets higher and higher as we approach the festive seasons of Eid and coming together. And I hope the advice that the Ministry of Health and health experts give would be adhered to make sure that we minimize the risks that comes with this practice of coming together and social gathering, which happens a period like now much more than other times. Let me now switch our gear to the East African community developments within the EAC. As you know, lots of things are happening globally on this pandemic. The amount of disruption that it has caused, not only in people's lives, in economies of many countries, but it has also had significant impact negatively on global commerce. But without global commerce and without movements of goods, pharmaceuticals, and essential goods, we will not be able to defend ourselves against this virus. And it's for that reason that within East Africa, which we are part of, we came together as East African member states to see how we can develop an understanding of driving our commerce with minimal amount of disruption, because we cannot guarantee disruptions will not happen. The queues that you were shown of trucks, which in some cases have been as long as 40 kilometers, I think is as a result of this pandemic, which we cannot ignore. And so the agreements amongst all member states is cargo would be allowed to move across all member states without any restriction. And that is the position before, it is the position now, and it will be the position going forward. However, because these trucks are driven by people, each of these drivers must be subjected to coronavirus tests. If they have been done in their home countries, then they will be given a free pass at the borders. If, however, they have not been tested in their home countries, then it is an understanding between member states that the countries which trucks are coming into would have the obligation to do tests. So when our trucks go from here into Uganda and they don't have the tests for drivers, then the Ugandan authorities subject our drivers to corona tests. We do the same for our for drivers coming from Tanzania, and we do the same for all drivers coming from everywhere, including Ethiopia. And so it's not a unique development into any one member states. It's an agreement that is consensus by all member states. And it is the right thing to do, because it doesn't matter how good we are in protecting ourselves as an individual country, given the porous nature of our borders. We must come together collectively to win, to fight this successfully. Now, I'm sure many of you have seen the stories arising out of Tanzania about border closures and all sorts of things that have been alleged. The border, for the purpose of movement of cargo, has not been closed, and we are, including up to today, up to this afternoon before I came here, cargo trucks are moving into Tanzania from Kenya and from Tanzania into Kenya. As a minimum, we will guarantee as Kenya, we will not stop any cargo trucks coming from any member states, including Tanzania. That is an arrangement that we must abide with as one of the member states of EAC. And so I just want to make sure that we keep our record straight, that we will continue to support commerce within EAC region, but of course by taking the necessary caution of making sure that everybody gets tested the same way we subject our own people to those kind of tests. So I just thought I will make that clarification. If there are any other questions on your mind, we'll be more than happy to answer. But we really are committed. EAC remains the biggest trading partner for each of the other individual member states. For us, it is a significant market. It is important. We want to make sure that we focus on East Africa, and anything that will damage the relationships within EAC, we must deal with it. And we are engaging with our colleagues in Tanzania to make sure that any misunderstanding that might have arisen, and I've seen some video clips going around which we cannot verify, that our position as Kenya is cargo trade between all countries, including Tanzania, remain open, and we hope that is not going to be interfered with. Thank you very much.
Right. We can take one or two questions. Please, when you ask, please say your name, your media house, and who the question is supposed to be answered by.
Yep. My name is Stephen Leto from Citizen TV. I have questions that will go to the two cabinet secretaries. One for Tanzania. We have teams in Holili border in Taveta. They're saying that Kenyan truckers who tested negative are still stranded at the border. They cannot cross because of what Tanzania has declared that it is marufuku, not for the Kenyan truckers to get into Tanzania. And another question regard to the border is about Tanzanian truckers who test positive in Kenya and claim that they go to Tanzania and test negative, and so they are roaming around the border. So the question is, who ensures that they completely go to Tanzania, back to their country, if they test positive? Because there is a risk of more infections at the border. And my final question to CS Kagwe is with regard to Citizen TV is in possession of a confirmation of positive, at least 13 positive cases in Eastleigh that the Somali embassy has been conducting. Apparently, to our knowledge, we can authoritatively tell you, Bwana CS, that the 13 positive cases were not given their results and that they are likely to be roaming within the Eastleigh area. And so the question is the ministry aware of the same? And two, who communicates the test results? Is it the Somali embassy for this case or Lancet that is conducting the tests? Thank you.
My name is Felix from Citizen TV. My question goes to
Sorry,
Felix from Citizen TV. My question goes to the Minister for East African Community. Yes, stipulated that for truck drivers emerged from the origin of the country must be tested, given a certificate. Suppose the behavior, if you're saying the behavior of our neighboring country where they're behaving, is how can you ensure they are given certificates? Because they can give some certificate fee for them to come. How are you going to ensure that they are not going to be given fake certificates? They are not tested. When they come to the country, they just pass, and then they continue infecting our own people.
Maybe, yes.
My name is Angela Okech from Daily Nation. Bwana CS, we've had in the past weeks the number of...
Who's CS? Angela.
Health. In the past weeks, we've seen an increase in the number of tests that we are conducting, which means the more we conduct the test, the more we get the number of infection within us. If you could just tell us where exactly do we have we found the more infections? For instance, Isili and Kamkunji, which is the leading area in the number of infections, or rather the number of tests that we've conducted. Then secondly, there's a paper that has been published in one of the journals which says that most of the victims that dies of COVID-19 are as of the results die because of blood clotting. Are we seeing the same in Kenya, or what is our perspective? And then lastly, this is a request. Not all journalists can come for the pressers to ask for their questions to be answered. If we have a story and we request for your comment, it's very frustrating because we don't get answers from your officials. Thank you.
Okay. Maybe the last one then.
Nancy Okware kutoka KBC. Swali langu la kwanza ni kwa Waziri kwa Kagwe na ni kuhusiana na wale madereva ambao wanapimwa na kuelekea upande wa Tanzania, na mlisema ya kwamba wale ambao wanapatikana kuwa na virusi vya corona basi wanarejeshwa nchini kwao. Je, kama serikali kwa ushirikiano ule wa Afrika Mashariki mmekuwa mkihakikisha ya kwamba wale ambao wanapimwa na kupatikana na virusi hivyo na kurejeshwa, ya kwamba mmeifahamisha serikali ya Tanzania ili wachukue hatua ili wasihatarishe vile vile wale ambao watakutana nao kule? Na mwisho kabisa, kuhusiana, umesema ya kwamba kila mtu mmoja ni muhimu kabisa kudhibiti virusi vya corona, na hususan pale Dadaab ambapo tumeshuhudia visa vya virusi vya corona. Je, kama serikali mnafanya nini ili kuhakikisha kwamba wale waliotangamana na wale ambao wamepatikana na virusi hivyo wanatengwa?
Asante sana.
Thank you very much. I think let me just respond very quickly, and then the Minister can conclude later on. Now, the first question is on the case at Holili border. We have, as you know, our border points with Tanzania is Lunga, Holili, Namanga, and Isibania. We are keeping track of movements of cargo between all these, within these border points. Our biggest entry points today with Tanzania is Namanga, where we receive approximately 100 to 120 vehicles from Tanzania coming into Kenya. There has been some accumulation, of course, as a result of the delays. And we are aware that there are a few trucks of Kenyan registration that have been denied access and entry into Tanzania. But we have not stopped processing vehicles coming from Tanzania into Kenya, as I've said earlier on. So those isolated cases, and we are talking about 5 to 7 vehicles that have been slowed down. They are actually on the Tanzanian side, but they haven't been allowed to proceed. So we are dealing with some of these isolated cases, and we hope we will be able to resolve that very quickly. I think the issue of making sure that the quality and the authenticity of the test results of countries that have tested their truck drivers and they come with it, we don't want to draw any aspersions on anybody's test results. Of course, when trucks move, they don't just wander around everywhere. we have tracking systems, electronic tracking system on all cargo that moves along the northern corridor between Mombasa right up to Malaba border before they cross. So we know where they are at every stage. There are designated places where they are likely to stop, and we make sure that they actually are monitored. There was an attempt for us to escort these people, but that is something that is going to be extremely expensive. But if situation demands at a later stage, undoubtedly we will do that. At the moment, as we speak, Tanzanian drivers have not been coming with certificates, and that is why we have decided to do the tests in Namanga. As the minister mentioned earlier on, there will be a mobile lab that would be installed there. And the delay that you see there is because that we have to administer the tests ourselves, and we do not have any test certificates coming from Tanzania's side. Thank you.
Asante sana. Sisi, asante Nancy. Ya kwanza ni kusema ya kwamba sisi tunaamini ya kwamba tukirudisha madereva huko wanaingia upande wa Tanzania, sisi tunaamini ya kwamba Tanzania yenyewe itaanza kushughulika na hao watu wake, kwa sababu sisi kama Wakenya, kama health officers, hatuwezi kufuata watu Tanzania kuangalia ni kitu gani inaendelea huko. Hiyo sio kazi yetu. Kazi yetu ni kuwaambia tu ya kwamba nyinyi mjue mna hii virusi, na kwa hivyo ni tafadhalini mjikinge na muende mpimwe, muende quarantine. Hiyo ndio ile sisi tunafanya hapa katika Kenya. Kwa hivyo sisi hatuwezi kusema ama kujua ni maneno gani inaendelea watu wakienda Tanzania, lakini sisi tunatumaini ya kwamba wanafanya hivyo. Sisi ndio kwa sababu ni Watanzania wenyewe ndio wanaweza kuumia wasipofanya hivyo. Na sisi na Tanzania ni ndugu na dada. Watanzania ni kama Wakenya tu. Kwa hivyo sisi tungetaka kuona sana hii virusi haifanyi vile tunafanya Kenya. Tungetaka kuona tu tukifanya katika nchi zote za Afrika Mashariki. Ile ingine niliulizwa ni mambo na Angela, ulikuwa unasema ya kwamba unataka wakati unafanya story zako ufanyi ati sisi watu wa health atujibu vile wewe unataka tujibu. Ningetaka kuhakikishia kwamba kutoka leo hii utapata majibu. Si ndio yatosha? Asante. Na vile nitauliza bwana Daktari Amoth ashughulike na hiyo maneno ya kuona ya kwamba sana vile ile mambo ambao rafiki zetu wanataka ni mambo kuhusu vile ilivyo. Kama sasa nimeulizwa kwamba kama mtu anauawa na
Legendary beat. Legendary beat. Legendary beat. Legendary beat.
I get girl from my yard, we get big back away, they make me feel amazing.
Je, maumivu ya kichwa na kukosesha amani? Kaluma Strong hutuliza maumivu ya kichwa, maumivu ya mwili na hata huondoa joto jingi mwilini. Kaluma Strong ina aspirin kama kiungo. Maumivu yakizidi, muone daktari.
Buy fresh mboga, vegetables, foodstuffs, meat products, bakery products, detergents, all clothing and footwear, books, board games, gym accessories, households and cookery online. Kindly visit tuskys.dpo.store to place an order and get delivered to your doorstep.
The National Council for Persons with Disabilities, NCPWD, encourages you to follow the ministry guidelines on COVID-19 by observing high hygiene standards. If either the person with disability or their primary caregiver experience any COVID-19 symptoms, they should isolate to further monitor the symptoms. The common symptoms for COVID-19 are high fever, headache, sore throat, coughing, and others. Any suspected cases should be reported to the Ministry of Health hotline numbers 0800 721 316 or 0729 471 414. Remember to include the person's disability if and when reporting cases of COVID-19 involving a person with disability. National Council for Persons with Disabilities. Disability rights are human rights.
Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap.
My name is Michael Olunga. I'd like to take this opportunity to wish all my fellow Kenyans peace and safety during these difficult times as we fight the coronavirus pandemic. Please follow the instructions given by our President, His Excellency Uhuru Kenyatta, and the Ministry of Health as we fight the coronavirus pandemic. For example, wash your hands thoroughly with running water and soap or use sanitizers where necessary. 2. Keep your environment clean. 3. Stay at home and avoid unnecessary movements. 4. Take the necessary precautions to keep yourself and your family safe. 5. To my fellow athletes, please train in isolation and take necessary precautions. We shall overcome this pandemic. May God bless you and God bless Kenya.
Mind-blowing music and entertainment. Just move to NTV.
Here at NMG, we are working very hard to ensure your favorite publications, Daily Nation, Business Daily, Taifa Leo and the East African are readily available. In a bid to support the efforts to prevent the transmission of COVID-19, NMG has ensured our staff, our distributors and their staff adhere to set guidelines. At our printing plant, all staff are required to wash their hands before entering the factory and must be wearing a mask. All workers either change their clothes on entering the factory or wear an overcoat. We are keeping doors open to avoid our staff touching door handles repeatedly. With our automated printing, contact with the newspaper is kept to a minimum, and at the packing process, the staff observes social distancing. Vehicles used to transport the newspapers are disinfected daily before the newspapers are loaded, and our delivery staff all wear masks and wash their hands regularly. Our vendors ensure that they sanitize every time they handle money and wear their masks at all times. NMG is proud to be able to safely meet your information needs. Stay safe, stay informed with our favorite NMG publications.
NTV, turning on your world. The following program has been rated GE. It is therefore suitable for general family viewing.